Earlier this week, we learned just how hard the COVID-19 pandemic has hit MGM Springfield. Interim CEO Bill Hornbuckle said it could lay off as many as 1,887 employees from Western Massachusetts Lone Casino when temporary furloughs expire in August. As chairman of the Economic Development and Emerging Technologies Committee, State Senator Sen Lesser keeps tabs on one of the state's newest industries. And we spoke with him about that and more.
Yeah, so we've been in regular contact with MGM, of course, and also with the Mayor Sarno, who has a very important role to play in all of this as the host community of MGM, and also with the chair of the Gaming Commission, Chair Judd Stein, and her team. We've been in regular contact with them, and I've also been in regular contact with my co-chair, Ann Margaret Ferrante, who's my House counterpart. We've been doing regular calls with the Gaming Commission, hearing from them. We've also been talking to experts from around the country and actually around the world who have had experience with these types of situations, this public health challenge in other jurisdictions. So we're monitoring it very closely. Obviously, the safety and health of our community is the number one priority. Nothing can reopen, nor should anything reopen if it's not safe to do so. But we do know, and it's becoming clear, that this is going to create a very real economic challenge for our region.
Yeah, we saw Mass Live reported this morning that a WARN notice, essentially that's a letter saying this could happen, was sent to employees. 1,887 jobs could be lost as a result of this, was what the letter said. What's your reaction to that? It's a lot of jobs.
It's devastating news. It represents nearly 90%, I believe, or maybe even more than 90% of their total workforce. I'd point out that the letter said that those layoffs could happen at the end of August 31. So that is still a ways away. The world could change a lot between now and August. And we're certainly hoping that the virus gets under control, that the public health efforts do what they're supposed to do and help get the curve flattened and the curve even going down, and that would hopefully allow us to do a safe and medically appropriate reopening, which would help preserve and hopefully alleviate some of those layoffs. But let's just cut to the chase here, Carrie. I mean, the casino industry, the hospitality industry across the board is going to look very different tomorrow, next month, next year than it did a few months before today. So we need to be prepared for that reality. This will have a dramatic impact on the gaming receipts that, of course, the state uses to support local municipalities and to support programs across state government. And obviously it could have devastating, really, I would dare say, catastrophic impacts on the economy here in Western Mass, where 1,800 people could potentially lose their jobs. So I am very focused on this. We need to surge resources to those families. We need to make sure that MGM does the right thing by the families who have been impacted, and we need a plan. We need to have a plan both for getting the virus under control. I think that Governor Baker needs to do more to get that curve flattened, and we need a plan for reopening that is safe and that is dictated by science.
What more would you like to see the governor doing, to your point?
Yeah, so it's clear that right now here in Massachusetts, we've reached a plateau, so to speak, of cases. We certainly are no longer seeing a surge, and in fact, there's a lot of data now that hospitalization rates have gone down and continue to go down. Here in Western Mass, that's certainly been the case for our local hospitals. Except I don't think it's fair now, and nor is it accurate to say that the curve is going down. We've reached a kind of plateau of cases. And what I think we need to be asking ourselves is, what do we do to change that plateau, to get those case counts further down so that people feel safe and feel comfortable participating in the economy, going out and doing their daily tasks. Nobody will do that unless they feel like they can do it safely. And I think we need more information. We need more resources to make that happen. I think personal protective equipment is still a challenge. We're hearing from businesses that still have trouble accessing it. I think access to testing, especially testing here in Western Mass, testing in some of our most vulnerable communities is a major challenge. We need significantly more resources to get testing where we need to be. And while I do think Massachusetts has made some progress on a contact tracing program, that contact tracing program needs to be dramatically broader in scale and farther reaching than it currently is for us even to begin to approach numbers that you see, for example, in Taiwan or South Korea, which are areas of the world that have been pretty successful, relatively speaking, at combating the virus.
Speaking to that testing piece specifically, do you think that it would be wise for the governor, or would you like to see the governor maybe lean more on some of the institutional resources we have here in Massachusetts, whether it's at UMass? I know that there's a group there hoping to pilot a quick test that they liken to a home pregnancy test where you could take it at home and know, okay, yes, I have the coronavirus, something like that. Or what would you say in terms of testing?
I mean, we're blessed here in Massachusetts to have some of the greatest medical capacities of anywhere on earth. We have some of the greatest teaching hospitals, research universities. You just mentioned UMass, the Broad Institute, which is already helping, Harvard, others. But there really needs to be a military style mobilization, so to speak, to get the testing to the capacities that we need. And look, the testing is a complicated endeavor until there are some pretty important scientific breakthroughs. And I would advocate, by the way, that we need to surge resources. I would like those breakthroughs developed in Massachusetts, in our life sciences sector here in Massachusetts, that we don't have to rely on other countries to do it, and we should be surging resources to our local research institutions, our local universities, and biotechnology leaders to get that done here locally. But what I would say is it does feel like the foot is coming off the gas a little bit, which I think is a big mistake in terms of focusing on the testing access. And as I was saying, the testing is a complicated process right now. First, you need the personnel to do it. The personnel need to be in full protective gear. You need the DNA reagents to actually conduct the test. You need the swabs to administer the test. You need staffing to make that all possible. And you need outreach in the community to make sure people know it's available. And then what I would point out, Carrie, is the testing is really only one side of the equation here. Once you have the test results back, you need a comprehensive contact tracing program in place so that you can identify quickly who tests positive, get resources to that person, make sure that that person is able to quarantine either at their home or another location where they can get the support they need, they can get the paid sick time they need. And then very importantly, a contact tracing effort has to happen where the immediate known contacts of that positive patient are similarly notified and similarly quarantined for up to 14 days. It's a massive undertaking. It's not something that can be turned on overnight. So I think we need far more mobilization than we're seeing. And again, this is an unprecedented and very, very dangerous and very new situation, of course, but we're not operating completely in the dark. There's a lot of lessons learned from around the world. We have the data that's now coming back from Asia, from Taiwan, from South Korea, from Singapore, from Hong Kong, about what's working, about what's not working. We're seeing certain countries in Europe where the curve has gone down, other countries in Europe where the curve isn't, and we can begin to learn some lessons from those places. And by the way, Carrie, we can also look at lessons from history. The cities that opened earlier during the 1918 flu pandemic actually over the long run saw their economies hurt more than the communities that were patient and did what they need to do to get the virus under control. There's a very important paper that just came out that the Federal Reserve posted about that, the New York Fed. So we need to learn from history, we need to learn from other jurisdictions, and we need to make sure that the virus is under control, and we need a plan to make that happen.
You mentioned mobilization a moment ago. A slight pivot here. Secretary of State William Galvin came out late last week and said he really wants to see some more action regarding mail-in voting and the legislature taking some steps to make that happen. You and your colleagues have not been quick to act on this measure. When do you think we might see some movement, some decisions made around this issue, which the clock is ticking in terms of getting ballots printed on time?
Yeah, so I have a bill, a vote by mail bill, a universal vote by mail bill that I've co-sponsored in the Senate the lead co-sponsor in the Senate on that measure. We worked closely with Common Cause, the nation's leading voting rights advocacy organization, along with the ACLU and several other progressive groups, the League of Women Voters, to put that proposal together. I'm a strong supporter of mail-in voting and safe elections. Look, this has to happen. This is common sense. I'm frankly confused a little bit about why it's taking so long for us to get this done. But the idea here is pretty simple. You have to maintain an in-person voting location because some people can't vote by mail, whether they don't want to, or they don't have the means to, or they forget, or whatnot. So you need to make sure that the in-person locations are safe. And again, South Korea just had a national presidential election in the middle of the coronavirus pandemic, and they did it safely. They gave voters gloves, they gave voters disposable pens, they had everybody distanced in line. So as a last resort, you need to make sure that the in-person voting is done safely. The other thing we need to do is dramatically expand the early vote process. So my bill that I co-sponsored would allow 3 weeks of early voting in person to space those lines out. Again, instead of compressing everybody into one day, you allow 3 weeks leading up to election day where people can show up to vote in person. We would do 2 weeks for the primary election, which is September 1. And then in the general election in November, we would do universal access to mail-in ballots, which means every voter in the state would get mailed a ballot with postage paid for the return, so that the entire process can be done by mail if that's what people want. And they would have an easy way to do that because, again, it would automatically get mailed to them. This is going to happen anyway because, frankly, if we don't do this, what's going to end up happening is a lot of people are going to request ballots by absentee. And in last election, I believe only about 3 to 5% of Massachusetts voters actually voted by absentee. There'll be 10 times that at a minimum this time around. So frankly, our local elections offices, the state government is going to be overwhelmed by these absentee ballot requests if people, if we do nothing. So I think we need to get in front of this. We do not want to have happen here in Massachusetts what happened in Wisconsin. There was a presidential primary election in Wisconsin, again, at the height of the pandemic. More than 30 cases have now been traced back to people who stood in lines during that vote that happened in Wisconsin. We do not want that happening in Massachusetts. Voting is a constitutional right. It's a sacred right that we have as American citizens. People should not have to decide between protecting their health and exercising a constitutional right. This isn't the Apollo moon launch. Mailing ballots to people is really not a big deal. Oregon has been doing it for many elections. California, a state much bigger than us, also just announced that they're moving to mail-in ballots for their elections. So there's a lot of blueprints here for how to do it right. And I think we got to get in front of it and do it quickly.